I'm Dr. Nick Bagnero, Health and Stability Spinal Care, and I'm being joined today by Sean Geyer, who's the co-owner of Barry Sod, and we're going to be talking about his experience with treatment in our practice, and particularly the Class 4 laser. So Sean, thanks for being with me.
Hey, you're welcome.
First thing I want to know is you and your family are been upper cervical patients, your wife and 2 daughters, and what's your experience of being under upper cervical care?
Well, I suffered greatly most of my life with terrible migraine headaches, and so since I've been under the care of you and your wife, that I've had headaches are gone. I notice I have a lot more focus, a lot more energy.
Awesome.
My hands aren't numb like they used to be.
Sure.
So
Great. Well, appreciate that. I'm glad it's been working out for you. So tell us how about your shoulder. I know you injured your shoulder, and tell us about that injury.
yeah, unfortunately, in our business, we have a lot of manual labor, especially when I was starting out. We did everything by hand. We throw pallets repetitively over and over again from the ground up to the truck, from the ground to the truck.
Right.
And that motion wore out my tendons in my joints. And so I developed arthritis and bone spurs that were pretty severe.
Sure.
And I had therapy
Right.
that was going to try to, fix it just through exercise. That didn't work, so I ended up having surgery.
Right. And then the surgery, they removed the bone spurs and the arthritis, they scraped all
Correct.
that out. And how was your condition after the surgery?
Well, I was still in a lot of pain, and unfortunately I can't take anti-inflammatory medication,
Sure.
which they recommend to do that, and so the arthritis was returning quickly after surgery. And I was in severe pain before I came to you.
Right. Well, how was the pain affecting your life and family and work and all that?
Oh, I couldn't do my basic functions around the house. Was basically helpless for quite a while. My wife was getting frustrated.
Yeah.
And I complained to the doctor that I wasn't getting the progress that I thought I should have.
Okay. And so I think we started you about 2 months after your surgery that we first used the laser on you, roughly. And tell us about your first laser treatment. What did that feel like?
Well, it was something I've never experienced before. It was within a few hours after the treatment, it was quite painful. But I also noticed that I had quite a bit of mobility.
Right.
The next day.
Sure.
Rapid recovery from how far I could move my shoulder before.
Right.
And within a couple more treatments after that, I started experiencing several 100% increase in strength.
Excellent.
Yeah.
In the muscles themselves.
Oh yeah, absolutely. And the
Right.
inflammation has gone down quite a bit. And I've started to be useful around the house.
I understand your physical therapist did an ultrasound on your shoulder the next day after your first treatment.
Yep.
And noticed a dramatic increase or decrease in the inflammation. Is that right?
That's absolutely right. In fact, they were so impressed that they started asking questions about, we've heard of Class 3, but what's this Class 4?
Yeah, they hadn't heard of it yet.
I was more than happy to
I'm
tell them
happy to
that.
let them
Yeah.
know about what we're doing. So how many, are you out of pain now with the shoulder?
It's a lot less, and I've also not had to take as much pain medication as before, which is nice considering I have to run my business.
Right.
And that makes it.
You can't be all drugged out if you're running.
No,
a
sir.
business.
No, it makes it a little harder.
Not if you want to be successful.
Right.
Now, how many treatments have you had at this point?
I want to say I've had 3 or 4.
3 or 4?
Uh-huh.
And you're doing that good with just 4 treatments?
Yeah, in fact, I've actually backed off the physical therapy some because I'm doing so well.
Sure. And if I remember right, I think you said too that your physical therapist after 1 treatment said that you would probably cut at least 2 weeks off your therapy time. Just by the progress you've seen.
Absolutely.
Yeah. That's a remarkable change. And so, so how's your life now, and are you satisfied with the treatment?
I'm more than satisfied. You go into anything hoping for the best, but this far exceeded my expectations.
Yeah. So far it's exceeding mine too.
Well, fantastic.
Treating patients.
Yeah.
And what would you say to other people if you were, if they were in pain, if they're sitting there watching this, thinking, I wonder if this will help me?
Well, I'll say this. Traditional medicine has you, first take the medication, then go get the surgery. I think that the best approach would be to try to find a natural remedy before you do those things. I know I would have, and I hope the same for someone else.
Sure. Thanks again for your time.
You're very welcome.
Thanks for listening.